Hello and welcome to the Blossoming Bellies monthly webinar series. My name is Brittany Sharp McCollum. I am your host and your facilitator. I own Blossoming Bellies Holistic Birth Services, which is based out of the greater Philadelphia and South Jersey area. I am a childbirth educator. I'm a birth doula. I'm a lactation counselor, and I'm a perinatal pelvic biomechanics educator, which basically means I help people understand how positioning in labor can decrease intervention and improve efficiency during the birth process. Today's webinar is all about late pregnancy changes. So those things that people can expect in late pregnancy as the body prepares for labor and birth, as well as some things that may not be so normal that are worth looking into, and then also red flags. We're going to go over all of that stuff. I always like to make my webinars and classes and everything interactive. So we're also going to do a couple exercises, not like workout exercises, but a couple exercises along the way that you're welcome to participate in, or you can kind of save them for later, whatever you feel comfortable with. Just keep in mind, please, that anything that I ask you to do in our webinar is totally up to you. Make sure you do what feels comfortable to you, especially when we're talking about movement and stretches and things like that. I also like to offer modifications so that if I'm suggesting something that might not fit well for everyone, then you have another option to go off of. Or of course, you can always just observe. That's totally fine as well. So just a bit more about the webinars before we move into the content that I want to talk about today. So for the past few years, I've been offering webinars monthly. Sometimes they are webinars that I host. Sometimes I have guest speakers, which I love because then it's also an amazing opportunity for me to learn from some really great people that we have available in the community. And we have webinars on all different topics. There's a whole bunch of free webinars, including information about pushing, information about induction, information about physical postpartum recovery, as well as a whole bunch of other stuff. So I do like to do free webinars every 2 months or so. And then we also have a bunch of low cost webinars, $15 each. And all of those that have been recorded within the past year offer contact hours for birth professionals. So our webinars are intended for both expecting parents, sometimes depending on the topic, postpartum people as well, and also birth professionals. So we kind of aim our audience to include all of those people. We have a whole bunch of stuff coming up. You can check it out on the website at blossomingbelliesbirth.com/webinars. And you can see what we have coming up over the next few weeks or next few months. Our next free webinar, I think I have that scheduled for December or January. That next free webinar is going to be all about understanding cesarean birth. So that I think should be a real fun one to talk about too. So today we're diving into late pregnancy changes. So what can be expected or what is maybe not expected in that third end of the third trimester. So I'm going to go ahead and share my screen with you. The way that I like to work webinars is that if anybody has any questions, those questions can be posted in the chat. And then at the end of the webinar, I'll go through the chat and answer any questions. So I will probably leave about 5 to 10 minutes or so at the end to answer those questions. But that way, in case there are questions that are coming up that I'm going to get to down the road, we can kind of see them and be like, oh, we already answered that. Keep moving. So questions that you have, go ahead and put them in the chat as we go, and I will check them at the end. And I always also welcome you to either reach out to me if you need additional information. My email address is blossomingbelliesbirth@gmail.com. And you can also follow along on social media where we have all sorts of great information, videos, research, things like that. And you can find me on Instagram, Facebook, and TikTok at Blossoming Bellies Birth. So you can check out all of those ways to either get in touch with me or find more information. So late pregnancy changes, what to expect as the body prepares for birth. So here is my just little disclaimer. Remember, this is information. I'm not in a position to diagnose anything. Obviously, we're not doing anything clinical here. If you have questions or concerns about your health or the health of your baby, it is really, really important that you reach out to your clinical care provider. This webinar is information-based and providing you with as much research-based information on these topics as possible, but it does not take the place of care that you're receiving from a clinical provider. So think of this as a jumping off point, and then specific questions about your own pregnancies that you might have that might require more of a clinical outlook. Those are the questions that you want to bring to your provider. I also ask that you don't reproduce or share the recording or the slides in any way. I'm totally fine with you, taking screenshots for your own personal use. That's fine. But I just ask that you don't post the whole thing on social media or something like that. You're welcome to take a screenshot here or there. I ask that you tag me in social media if you do that, but just don't post the whole presentation, obviously. All right, so let's dive in because we only have an hour together, which feels like it should be a long time, but it's never enough time. So our objectives today are to explore the physical and emotional changes that may occur as the body prepares for birth. Really important here. All of these things don't occur in everyone. Sometimes people have one or two of these things. Sometimes people have things other than what we're talking about. But what we're going to be discussing here are the most common things that come up often in people's pregnancies. We are also going to identify potential red flags in late pregnancy. Of course, that's not fun stuff to talk about, but I think it's only fair to provide that information as well. And really not even fair, but ethical to provide that information as well. I know in having worked with pregnant families for almost 16 years now, I know that providers actually don't give very much information about red flags. They don't give a whole lot of information about healthy pregnancy either. It's kind of expected that you'll, get information somewhere else or just do what they say to do as you go. But it's also really important, I think, for people to understand not only what is normal and healthy in late pregnancy, but also what are some red flags. I think that's really important because it's not something that is often covered at prenatal visits. So we will talk about that in today's webinar as well. And then, as I mentioned, we're going to do a couple little exercises. Participate as much or as little as you'd like with those. But the intention is to create connection with the baby through movement and mindfulness. When we're talking about movement, I'm not talking about a workout. I'm not talking about even like a yoga thing. I'm not talking about that. We're just talking about some really simple ways that we can move our bodies to help provide mobility in preparation for birth and postpartum. And then also a little kind of introspective mindfulness exercise that just helps to, again, better create that connection. So these are our objectives for today. Physical and emotional changes that are quote unquote normal in late pregnancy. What are some red flags? And then let's create some connection between the body and the baby and this upcoming birth journey that you're going on. So thank you all for joining me today. Ignore the barking dog in the background. I don't know if you can hear her on the mic, but she's very loud. The mailman must have come. Okay, so let's talk about these physical changes. So what you're going to see, we kind of have the same format that we're going to go through for physical as well as emotional changes. What you can see here, let me move these pictures of you guys over. There we go. What you can see here is that I have at the top, some of the time, all of the time, none of the time. And that's really important because, again, some of these things occur for everybody, or not for everybody, but for some people experience all of these things. Some people experience some of these things, and some people feel like they never experience any of it. You don't have to experience these things in order for labor to begin. That is so important to point out. One of the things that I notice a lot when I teach birth classes is that people have questions about the mucus plug. And sometimes the expectation is that the mucus plug will always come first. And we're going to talk about that way more in depth. The mucus plug will always come first and then labor. And then people are really concerned if they're 41 weeks pregnant and they haven't lost their mucus plug yet. Totally okay. You don't have to lose your mucus plug before labor begins. So that's what I mean by some of the time, all the time, none of the time. These things don't have to occur for labor to start. If they have not occurred, you could still go into labor that day. If they have not occurred and you are planning an induction, you could still have a vaginal birth with the induction. But sometimes people experience all of these things, and that's also totally normal. So let's go over what these are. Low backache. So low backache in late pregnancy is really common from carrying that extra weight in the front and the muscles being lengthened from that hormone relaxin that softens everything. So sometimes we get some achiness in our low back. One thing that can be really, really helpful to prevent low back achiness is keeping your core strong during pregnancy. So whether that means doing some sort of prenatal fitness class or seeing a pelvic floor physical therapist, which is something I would highly recommend. I know you're thinking pelvic floor, how does that relate to my core? Because it's totally all related. If you are having issues with the pelvic floor, it can lead to core issues and vice versa. So sometimes low backache is just normal. Sometimes low backache is a sign that maybe the core isn't quite strong enough to be stabilizing the lower back. But then also sometimes low backache can actually be kind of like an early labor sign. So what we want to pay attention to is that low backache happening just at the end of the day when you know you've been on your feet all day? Or are you noticing that that low backache has kind of a consistent rhythm to it? It kind of comes and goes, but really consistently. That might mean that it's something more related to possible labor. So if that's the case, if you're noticing a rhythmic, consistent backache, keep that, keep tabs on that. Make sure you're checking kind of in on yourself during the day and seeing how that is progressing or if it's going away. We'll go over some nice stretches for the low back as well, which can help with that kind of normal discomfort that happens at the end of pregnancy. Then we have loss of the mucus plug. So I think the mucus plug is super fun. As a doula, I love it when my clients send me pictures of their mucus plugs because I'm like, oh my gosh, this is great. This is another way that the body is visibly changing in preparation for birth. Does it happen to everyone? Absolutely not. Does it mean that labor is going to start that day? Absolutely not. Does it mean that labor is going to start that week? Absolutely not. It could, but it might not. But it's just another really visible sign that the body is making some change. So let's talk about what that mucus plug is for a moment. So the mucus plug is this glob of mucus that literally develops inside the cervix. So if you're thinking about, I should have put in a visual here, but I didn't. So let's use our imaginations for a minute. If you're thinking about a balloon that's blown up, so you have the balloon here and you have this little tail end at the bottom of the balloon. So picture a balloon that's blown up, maybe not tied at the bottom. So it kind of looks like this with a little tail. That little tail end is like the cervix, and that blown up balloon would be like the uterus. So the cervix has some length to it. It's usually anywhere from 2 to 5 centimeters thick or long throughout pregnancy. And it is soft tissue. It's like a sphincter, basically, like the anal sphincter or the bladder sphincter. And so over the course of pregnancy, inside that sphincter that is the cervix, mucus develops. And so the mucus is like a nice barrier protecting anything from getting into the uterus. And so that mucus plug in there does sometimes at the end of pregnancy begin to come out as the cervix softens, which we call ripening, in preparation for birth. And as the cervix softens, that mucus starts to come out into the vagina. It's not like you're walking down the hall without pants on and like plop, there goes your mucus plug. It's not like that. It's more like you go to the bathroom and you wipe and you're like, oh wow, there's like all this stringy, globby mucus on the toilet paper. That's the mucus plug. It could literally be like a spongy glob of mucus that could be the size of a quarter or smaller, but could be as large as the size of a quarter. Or it could be more like strands of mucus that you notice just kind of keep coming out every time you wipe. All of that is normal. The mucus plug also has some color to it sometimes. It can be more of like a creamy color, but it could have pink streaks in it. It could have bright red blood in it. It could have brown blood in it. When we're talking about blood in the mucus, we're not talking about active bleeding. We're talking about the mucus that comes out having little spots or flecks of blood in it. That's what we're talking about, not active watery bleeding. You'll notice that active watery period-like bleeding is something that's on our red flags list, not something that is part of our normal late pregnancy change. So this mucus plug could come out the day you give birth. It could come out 2 weeks before you give birth, or really any time within that time frame. The thing is, though, that mucus comes out, but it continues to regenerate. So even if you lose your mucus plug a week before labor begins, you may also continue to lose a lot of mucus once you're in labor. Totally normal. So the mucus plug is one of those fun visuals that you can look forward to possibly at the end of pregnancy. A couple other things, and these are more self-explanatory: change in appetite, so feeling really, really ravenous or feeling like you're really not hungry at all. Big changes in appetite like that. Big changes in energy level. We often talk about people feeling like they're nesting at the end of pregnancy. And interestingly, partners often talk about having a nesting sensation as well. So nesting is typically when you have all this energy and you want to get all these last minute projects done. And then oftentimes that increase in energy that maybe comes around 35, 36 weeks of pregnancy, and again, can vary from person to person. But sometimes then what follows that is this like, oh my gosh, I'm so tired. And you just need to nap for a couple of days. So we see those big changes in energy level. That is totally normal too. Loose stools. This is another fun visual that you can look forward to possibly at the end of pregnancy. Sometimes in the days leading up to birth, the body cleans itself out. You have all this relaxin kicking into high gear. And relaxin, again, is that hormone that softens everything. Sometimes the combination of relaxin and prostaglandins, which are other hormones, cause all these loose stools, cause some intestinal contractions, and you get kind of almost like not quite like a diarrhea. It's not uncontrollable, but some really soft stools, which can sometimes be nice for people that have suffered through constipation during pregnancy. Again, loose stools don't always happen. Sometimes they do happen. But if you have a couple days of loose stools and you're at the end of pregnancy, well, you can kind of think about that as one of those ways that your body is moving towards the birth journey. Then we have vaginal discharge. Vaginal discharge is different than the mucus plug. People do experience more of a thick vaginal discharge towards the end of pregnancy, but this is going to be more like a discharge that's kind of in your underwear as opposed to mucus that's coming out when you wipe, like what we talked about with the mucus plug. Vaginal discharge can be creamy in color. It should not have a foul odor. If it does have a foul odor, you definitely want to check in with your care provider. But it can be a little bit whitish or creamy in color. Vaginal discharge does not have any blood in it. Mucus plug can have flecks of blood, pink, red, brown, in it. Vaginal discharge should not have any blood in it. Vaginal discharge is, again, more of that like whitish or creamy color, should have maybe a mild smell to it, but it should not have a foul odor to it. Again, some people don't notice increased discharge in late pregnancy. Some people do. Totally normal if it's happening. Also totally normal if you're not noticing it. Leaking breasts and chest, this is something that some people experience as well. So the body produces this first milk called colostrum, and that's produced from the second trimester of pregnancy on. Now, sometimes this colostrum leaks out during pregnancy, and it might look kind of golden in color. You notice it coming out of the nipple openings. It might be like if you massaged your breast, you notice little drops, golden drops on your nipples. That would be colostrum. That's that leaking that we're talking about. Sometimes people notice a golden crust on their nipples, like maybe you take your bra off and it's like, oh, there's this little weird crust there. That's colostrum that just kind of came out and dried. Other people don't notice colostrum coming out at all. Totally normal. The body is producing it, whether or not you actually notice it leaking out or whether or not it actually is leaking out. Sometimes people experience leaking in a second pregnancy, third pregnancy, but never experience it the first time around. Sometimes people experience leaking the first time around. So it's a great sign that like, hey, yeah, your body's getting ready. If you're planning to nurse your baby, it's a great sign like, yeah, there's something in there. But there's something in there whether you notice the leaking or not. So if you're not experiencing the leaking, please don't feel like something is wrong. That is totally normal and okay as well. And then increased urination. I mean, this only makes sense, right? The baby is literally using the bladder like a pillow. Or if your baby was breech, your baby is like, using your bladder like a trampoline. And so it's normal to have all this increased urination as you're carrying this full-term baby in there. You have I don't want to say a big baby. You have a baby that's 6 pounds, 7 pounds, 8 pounds, 9 pounds, maybe 10 pounds in there. That's a lot of extra weight on the bladder. It's normal to have that increased urination. Sometimes at the end of pregnancy, if you cough or sneeze, or if you laugh really hard, sometimes we pee ourselves a little bit. That can be normal at the end of pregnancy, but that should not be something that is persisting into the postpartum. In the first 1 to 2 weeks postpartum, the pelvic floor muscles are regaining some of that strength and stability. And so in the first 1 to 2 weeks, we might notice a little bit of leaking. But if you're 3 months postpartum, you're 6 months postpartum, and you're experiencing leaking, that is not normal. That is definitely a time to reach out to a pelvic floor physical therapist. But here we're talking about increased urination with the intention of going to the bathroom to empty your bladder because you feel like you have to pee. That's what we're talking about. That's totally normal. Leaking at the end of pregnancy can be normal, but we definitely want to have a pelvic floor physical therapist on our radar for sure, so that that's not something that persists into the postpartum. So these are some of those common physical changes that happen at the end of pregnancy. And all of these, as we discussed, would fall into the category of normal. Sometimes people experience all of these. Sometimes people experience 1 or 2 things. Sometimes people don't experience any of these. And all of that is totally normal at the end of pregnancy. And just for those of you that joined us recently, just so you know, if you have any questions about any of this stuff, please feel free to write them in the chat. And at the end of the presentation, I'll go through the questions and see what we haven't answered already in the presentation. All right, so here are some things that might be normal. So we talked about what is normal. Here are things that might be normal, meaning like, let's keep a closer eye on these. Swelling. So this is one of those things that I feel like people talk about all the time. They totally normalize it. They totally normalize being super swollen at the end of pregnancy. Swelling, a little bit of swelling is normal. But if we're talking about excessive swelling, we're talking about discomfort from swelling, that could be more of a red flag. It could be a sign of something more serious, like preeclampsia, but also commonly it could be a sign of electrolyte imbalance in the body or possibly fluid retention in the body. So taking a look at your nourishment, taking a look at your hydration, that's going to be really important. We definitely want to make sure we're getting electrolytes at the end of pregnancy. And we also want to make sure that we're staying well hydrated, meaning half your body weight minimum in ounces of water per day. So for someone who's 200 pounds, that would be 100 ounces of water per day minimum. If you are moving a lot, if you're sweating a lot, if you're drinking something caffeinated, an extra glass of water to compensate for that extra fluid loss. So we want to make sure that we are staying well hydrated so our body is able to let go of fluid. We also want to make sure that our electrolytes are balanced, meaning that we are possibly using things like sea salt just in cooking, not like, getting salt from like boxed macaroni and cheese and things like that, but instead trying to incorporate sea salt, trying to incorporate things like potassium and magnesium into our diets. These things are often in prenatal vitamins, but they're not as well absorbed when we take it from a vitamin source. So we want to make sure that we're eating a variety of fruits and vegetables. We want to make sure that we are using something like sea salt, or granulated kelp is great in pregnancy to help balance those electrolytes as well. Electrolyte drinks can also be a good idea, and those are some ideas to kind of manage what we would consider like maybe normal swelling, but definitely not dangerous swelling. But sometimes swelling can be a sign of something more serious like preeclampsia. So it's always a good idea to check in with your provider if you are experiencing a lot of swelling. Also, just to let you know, if you're like, oh, the nutrition stuff sounds really interesting, we have a free webinar all about prenatal nutrition. That's on the website too. That's a recording from, I think it was over a year ago. So you can find that on the website if you're interested in diving into an hour of nutrition talk for pregnancy. Some other things that can be common possibly in late pregnancy, nausea and vomiting. So sometimes this goes along with those changes in appetite. Sometimes people do feel nauseous, especially in the day leading up to labor. But if you, again, are experiencing nausea or vomiting frequently, or if it's keeping you from being able to eat, check in with your provider. Hip and low back achiness. We talked about this a little bit, right? So it's normal because you have all this extra weight in the front, lengthening those muscles in the back and that relax and softening everything. It's normal to have some low backache. But if that low backache is persistent to the point where it's affecting your daily life, check in with your provider. If you're experiencing hip pain, one side or the other or both sides, check in with your provider. And sometimes providers don't offer a whole lot. They just say, oh, hip pain, back pain, that's normal in pregnancy. It's common in pregnancy, not always normal. It's generally a sign of some sort of ligament or muscle imbalance. And again, who do you see for that? Pelvic floor PT. Chiropractic care is also really awesome to help with that too. And I'm going to share with you in just a bit a really simple movement, kind of like a stretch that you can do in late pregnancy that might help to balance things a little bit more so that you get rid of any sort of hip or low back achiness. Round ligament discomfort, it's another thing that's common. Is it normal? Possibly, it's common, and the discomfort is often caused by, again, imbalance in how the uterus is lying. Would I say that that's normal? No. Is it a red flag? No, not at all. But it's something that maybe let's pay a little bit more attention to our balance so that we can figure out how to alleviate that discomfort. And again, one of the stretches that I'll show you is great for round ligament discomfort. Also, again, free webinar that we have called Functional Body Awareness for Labor Preparation talks specifically about things like very specifically about things like low backache and round ligament discomfort, and offers suggestions for just lifestyle changes and so forth that you can create to have a little bit more balance and stability and comfort in late pregnancy. So if you want to check that out, so you can dive deep into that physical side of things for an hour, you can totally go ahead and do that too. It's another free one. A rise in blood pressure can be very normal at the end of pregnancy, but if we're talking about a rise that's going into dangerous territory, like something 140/90, or if we're talking about a consistently rising blood pressure, that would be a red flag. But just a slight increase in blood pressure at the end of pregnancy can be common. That's something that a provider might just take note of, but would not warrant a red flag on your chart. Itchy skin. This is really common as the skin stretches. Sometimes people experience a lot of itchy skin in their upper back, which feels super weird, right? Like if my belly is stretching, why am I experiencing itchiness in the upper back? Because everything is stretching. Your rib cage is literally expanding in pregnancy. So as that skin stretches, we experience a lot of itchiness. Now, if you're experiencing itchiness that is on the palms of your hands, the soles of your feet, that's something a little bit different. Check in with your provider if you're experiencing that. If you're experiencing itchiness that is keeping you awake at night, check in with your provider. Definitely something that's more of a red flag as opposed to that normal itchiness that comes with areas of skin that are stretching, like the belly and maybe even the breast tissue and the upper back. And then a change in baby's movements. So let's explore that one a little bit more. So as we near the end of pregnancy, obviously things get a little bit tighter in there for the baby. The baby's a lot bigger. So you might not notice kicks and punches as dramatically as you were maybe around, 32 weeks or so. So it's normal to feel more of a rolling movement from the baby as opposed to a sharp kick or punch. Sometimes you might notice like a baby's elbow kind of rolling across your belly. That is totally normal. But if you are experiencing decreased movement from the baby, that's a red flag. And we'll explore that more in the next slide. So a change in baby's movements from sharp punches and kicks to rolling movements, normal. A decrease in baby's movements, that would be a red flag. So let's move on and talk about those red flags. So here are some end of pregnancy physical red flags. Again, this is not a fully comprehensive list. This is a good list to get you started. And then if there are additional questions or things that you're experiencing that you're like, I didn't hear about this at all in the webinar, that would definitely be a time to reach out to your provider. So we mentioned this before, and I want to go more in depth with this. Watery or period-like vaginal bleeding, not normal. Sometimes it can occur earlier on in pregnancy and everything is totally fine. Sometimes that can happen, but we always want to view it as a time to check in with a provider because it is not normal to have vaginal bleeding in pregnancy. Sometimes it can be okay, but it's always a time when you want to check in with your provider. The concern is that if that watery period-like bleeding has been caused by the placenta beginning to detach, then that decreases blood flow to the baby, and that is a truly necessary emergency cesarean birth for what we call placenta abruption. Sometimes there is vaginal bleeding that is not caused by placenta detachment, but we always want to err on the side of caution with this and always check in with a provider. Now, once you're in labor, it's normal to have little drops of blood in the toilet as the cervix stretches. But if we have period-like active vaginal bleeding, not normal, always a time to check in with your provider. So sometimes in teaching classes and talking about this, people are like, wait a second. So you just told me the bloody mucus is normal and totally okay, but period-like bleeding is not. How am I supposed to know the difference? Should I just always call my provider? Well, of course, you can always call your provider. That should be part of what they're there for, is to provide you with that reassurance or answer questions or, talk with you about concerns that you have. But here's the way that I like to describe the difference between normal bloody mucus versus watery period-like vaginal bleeding. Normal bloody mucus is kind of like if you had bloody boogers. You kind of have to go like looking for them. But if you had a bloody nose, it's like, oh my gosh, my nose is bleeding out of nowhere. I have to like do something. That's the difference. Blood in the mucus is more like you wiped when you went to the bathroom and you're like, oh, there's some like red flecks or some red streaks in this mucus. Whereas you sit down on the toilet and there's blood in the toilet, that's period-like bleeding. But if you are ever concerned, always, always, always check in with your provider. Really, really important. And next on this list of red flags, we have fewer than 10 baby movements in a 2-hour period of time. This would be after eating or drinking and resting to tune into the movement. So let me talk about that a little bit more. That's what we typically refer to as fetal kick counts. So we mentioned before, normal for babies' movements to change. Maybe they become more like big rolling movements. Kind of feels like you have a bowling ball moving around in your belly. That's normal, but it would not be normal for your baby to have long periods of time without movement. Sometimes you're going about your day and it's the afternoon and you're like, I'm not sure I felt the baby move. Probably because you were distracted, you weren't paying attention to it. But the best thing to do if you're ever concerned, like, haven't felt that much movement, eat or drink something, particularly something sugary, lie down on your left side for 2 hours and count the amount of times that the baby moves. You should have at least 10 movements from the baby within a 2-hour period of time. And you're lying on your side, you're being very attentive to those movements. Now, if you get like a double punch, that's 2 movements. If you get an elbow rolling across your belly and then a kick to your bladder or a kick to your ribs, those count as separate movements. So you want to be making sure that there's at least 10 movements within a 2-hour period of time after eating or drinking something. Again, if you'd feel more comfortable just calling your provider, absolutely go for it. That is what they are there for. So never hesitate to contact your provider in any of these situations. If you are experiencing dizziness, now that a loss of balance, or let's say greater imbalance in pregnancy, is normal as your center of gravity shifts. But if you're actually like in your head physically feeling dizzy, feeling like the room is spinning, feeling like when you sit up you're dizzy, red flag, call your provider. Severe swelling of the hands, feet, and face. We talked about how swelling can be normal, but if we have severe swelling, particularly swelling that literally changes the way your face looks, or swelling where your fingers look like sausages, or swelling where your feet going into your shoes are kind of like puffed up around your shoes, that is severe swelling. That can be a sign of preeclampsia. That is definitely a time to check in with your provider. And that severe swelling of the hands, feet, and face is one of those signs of preeclampsia. Oftentimes they are paired with things like blurred vision, persistent headaches, and protein in the urine, which is a reason why your providers are dipping a little stick to check for protein in your urine at every prenatal visit, or asking you to do that. So those 3 kind of go together. That severe swelling of hands, feet, and face, blurred vision, persistent headache, they're all potential signs of preeclampsia. So they are definitely, either if they're happening on their own or all together, absolutely a reason to check in with your provider immediately. If you develop a fever in late pregnancy, now maybe you just have a bug, maybe you have the flu, that's totally normal, but we always want to check in with the provider if we develop a fever in pregnancy. It could possibly be a sign of infection. So a uterine infection. So really important that we check in with provider if we're experiencing a fever in late pregnancy, even though it's more likely that a fever would just be, a sign of like some other type of, flu-like symptom, flu-like illness that you have, but always a time to check in with your provider. And then we have constant abdominal pain. So I mentioned that placenta abruption, where the placenta detaches before the baby is born, and how that is an absolute emergency cesarean birth, and how we have decreased blood flow to the baby there. Now, the symptom that we see with that, when that happens, sometimes we see that there is that active period like blood coming from the vagina. Now, constant abdominal pain is another potential sign of that placenta abruption. We're not talking about the rise and peak and fall of a contraction. We're not talking about a patterned contraction. We're talking about constant abdominal pain, constant abdominal discomfort, to the point where you're like, this does not feel normal. This does not feel okay. This is not my ribs stretching. This is not the rise and fall of a contraction. I am in constant pain in my abdomen. That is a time when you immediately check in with your provider. So this is by no means an exhaustive list of red flags, but these are things that can happen more commonly in late pregnancy and are red flags. But if at any point you have a question about anything in your pregnancy, make sure you reach out to your clinical care provider. And when I say clinical care provider, I'm referring to your midwife or your OB. So make sure you reach out with any questions that you have. So What are some things that you can do to address some of the common physical discomforts that are normal at the end of pregnancy? These are just a couple suggestions. Move your body every day. Make sure that you are going out for walks. Make sure that you are swimming, which can feel so good in late pregnancy. Obviously, we don't all have access to a pool, especially during winter months. But if you do, swimming is a really nice way to take a lot of pressure off of your joints and to really feel weightless, which is just, really nice when you're carrying that extra weight in pregnancy. So make sure you spend some time every day moving your body, walking, swimming, stretching, biking, whatever feels good to you. Generally, I would say avoid jumping movements. Even, sometimes people in their first pregnancies or second pregnancies, they're like, my pelvic floor is great. It's totally fine. I can jump. I can do all this. Now, you know your body better than anybody else, but we also want to be thinking about what you're doing now and how it could lead to issues down the road. So even though, you might be able to jump and that might feel totally fine at 9 months pregnant, what is that going to feel like when you're 9 months postpartum? What has happened because of that jumping you were doing at 9 months in pregnancy? So, be gentle with your body, work within your body's limitations, and recognize that you are super strong in pregnancy, but also we need to shift what we're doing to respect the boundaries of our changing bodies. Here's another thing, I even already mentioned this one. Drink half your body weight in ounces of water per day. If you weigh 200 pounds, you should be drinking 100 ounces of water per day. So that would be your minimum, and then more if you drink caffeinated beverage or if you are exercising a lot, sweating, something like that. Empty your bladder frequently. Don't hold it. This is really, really important. Now, I'm not saying if, you don't have to I'll just try to go. I'm not sure I have to go. I'll just try. No, we're not talking about that. But I'm saying if you feel like you have to pee, don't hold it, go pee. It's not a good idea to hold your pee in pregnancy. It increases your likelihood of urinary tract infections because of compression on the bladder. So as soon as we're feeling like, oh, I gotta go to the bathroom, let's make sure we go. And then try gentle stretches to become familiar with possible labor positions. So creating a little bit of muscle memory for the things that you might want to explore once you're in labor, and to lengthen the muscles used in birthing your baby. So I want to do a few just really gentle stretches with you now. You are absolutely welcome to join me. And for those of you that are attending live today, of course, you can keep your cameras off. But I'm going to move over onto the floor so that I can do these with you. And I will stop my share in just a second as well. So a lot of the things that we do in terms of labor positions are often on the floor, or obviously on the bed, which is great too. What I love to remind people of is that anything you're doing anything you would think of doing on the floor, you can probably also do on the bed, which may be better if you're birthing in a hospital, or of course, if you have an epidural. So let's see. So let's begin with just a couple gentle stretches that are really nice for creating a little bit of awareness and mobility in the pelvis. So here is your pelvis. Well, here's my pelvis. So I want to just start with a couple really, really gentle things. So let's begin in all fours. Now, if this is your first pregnancy or your first birth, you might not find yourself spending a whole lot of time in all fours. If you have a toddler at home, you might find that you're in all fours a lot more. But all fours is a really fantastic laboring position. But the thing is, we want to change position often when we're in labor, so we need to create a little familiarity with different positions within this position too. So these are some things that I would suggest practicing in pregnancy to maintain a sense of connection with your body, as well as to lengthen and kind of create awareness of some of these muscles that are going to be working during labor. So let's begin with our knees in a neutral position directly underneath the hips. And now I would like you to take your knees a little farther apart. So the soles of our feet can come together if that feels comfortable, or they can be a little farther apart, but your knees are far apart. So what we've done here is create what's called external thigh rotation. Now I'm going to change my angle just so you can see what I'm doing a little bit more, but my knees are still far apart. So with the knees far apart, what I would like you to do, if this feels comfortable to you, is just move down and back. So you're sticking your butt back, and then you're kind of thinking about rounding your lower back and coming forward. Now, this might feel like too much movement for you. So what you could do is just gentle rocking. Just decrease the amount of movement that you're doing. What I would caution you about, though, is when you do this one, make sure your abdominal muscles are not, your abdomen is not coning. So if you feel any sort of like almost like a burning sensation in the midline between the two sides of your abdominal muscles, you need to decrease the amount of movement that you're doing there. So if I feel burning here, then I'm not going to go that far. I'm just going to do this instead. But the idea is that with external thighs, we're doing some rocking. So we're getting some nice stretching in here, and we are providing a little bit of familiarity, creating a little bit of familiarity with a really awesome laboring position. That's a great position for laboring early on. Now, let's do the opposite of this. So now, let's bring our knees together and let's bring our feet farther apart. And again, your knees could be a little farther apart, but the idea is that now your feet are farther apart. So now, I'm going to change again. Now with the feet farther apart, let's sit back and forward. So we might not have, I know I don't have nearly as much mobility with this move as I do with the other one, but that's totally okay. But you feel some really nice stretching happening right here. And why the heck would we ever do this weird position? Because when we create internal thigh rotation, that's really awesome for pushing. So if you have followed any of the videos that I post on Instagram and TikTok, you'll see that we talk a lot about pushing positions that use a closed knee position. So that means internal thigh rotation. But that's kind of a weird sensation for a lot of people if you're not familiar with it. So we practice that in pregnancy. So we do some of this movement here. So these are two of my favorite movements for kind of preparing for labor. Now, I also like to encourage movements that help to ease low back discomfort and upper back discomfort. So staying in this all fours position, if you want to join me here, we can just do a little bit of cat-cow. So cat-cow focuses on your upper back and your mid back. So we are going to inhale and arch our lower back. And as you exhale, you want to act as if there is a string between your shoulder blades, pulling your shoulder blades up to the ceiling. So again, as we come back to neutral, we inhale, and as we arch our back, as we round the back, we exhale. So a few of these cat-cows, not coming into a deep arch here, but coming to more of a neutral position and then moving into that rounded back position. That is great for upper back tension and mid back tension, especially, you know, when you've had a few babies, the abdominal muscles they might be even a little more stretched in pregnancy. And sometimes our upper back winds up trying to compensate for that. So doing some of that cat-cow every day can be helpful. But I also like to focus cat-cow in the pelvis. So coming back into that position, we did cat-cow for the upper back. Now let's do a little bit more of a pelvic tilt motion. So rather than focusing on the upper back like we were here, let's focus on the pelvis. So again, doing as much mobility as feels good to you. So maybe you just do a little bit, that's fine. Maybe you do more dramatic movement, that's fine too. And my knees are just neutral here underneath my hips. So just some gentle pelvic rocking. Now, you could also do this pelvic rocking on a birth ball. So now let me show you a few things that you could do seated. So I have a big birth ball here, which is just an exercise ball. That's all that it is. So here I am sitting on my birth ball, right? I can do that same sort of pelvic rocking that I did in all fours. Also, another great exercise to do on the birth ball, you're watching TV at night, some slow circles. So you can do, I even heard something pop. That felt really good. So some slow circles to one side, slow circles to the other side. And all of these things that we're doing can also be used as labor movements or positions too. One thing that I would suggest, in addition to what I just shared with you, is spending some time just in a regular neutral all fours position every day. We mentioned that round ligament discomfort. Chiropractic care can be really helpful at managing round ligament discomfort, but sometimes chiropractic care can get pricey. Sometimes you might not have access to chiropractors, depending on where you're located, that are really well versed in working with pregnant people. So what I would suggest is, either in addition to chiropractic care, or if you don't have that option available, spend some time every day in all fours, not with the intention of getting the baby positioned a specific way or anything like that. That is not research-based. The idea of optimal positioning for a baby is not a research-based concept. That's a whole other 9-hour workshop that I teach. But I don't want to digress. My point is, spending some time in all fours allows the weight of the uterus to gently stretch the round ligaments, which are these anchoring structures that kind of hold the uterus in place, prevent it from tipping too far forward. But sometimes we have a little bit of imbalance where a round ligament is tight on one side and lengthened on the other. And that can cause the uterus to lie unbalanced, which can wind up leading to things like hip pain, low back pain, pelvic floor issues, thigh pain, groin pain, all that sort of stuff. So a really great way to help balance the uterus and allow the round ligaments to lengthen evenly is to, number one, see a chiropractor, pelvic floor PT, but then also check in with your body every day by being in that all fours position, giving your body a chance to just kind of regulate itself. I would say 5 to 15 minutes a day in all fours with a neutral back. You can rock side to side if you want, but try to spend some time literally just in that all fours position. If you need to rest onto a birth ball or rest onto your couch with your arms, you can do that, but try to keep your back flat. If you have your back at a 45-degree angle, it's not going to be the same thing happening. So we want a flat back, weight of the belly just hanging. Sometimes I've had people say that when they do that, they feel like they're either trying to tighten their abdominal muscles to hold the weight of the baby, or they're feeling too much stretching in their low back. If that's happening, put a stack of pillows under your belly so that you just have this very gentle support under the belly, which almost like tricks the mind into thinking like, oh, the belly is supported, so we don't have to try to activate anything. The goal is to not be activating anything when you're spending time in all fours like that. So, hope that was helpful. Now, let's go back. We still have so much to do and only 15 minutes to do it in. So let's go back to our slides here and talk about the emotional changes that occur in late pregnancy. So there are lots of normal, common emotional changes. Some of the time, all of the time, none of the time, these things can occur. Feeling weepy, feeling like you're just, you're crying at commercials, you're crying at birth videos, totally normal. Mood changes. Absolutely normal. Your body is going through a change in hormones like it never has before. It also, there's all that anticipation of the birth and the postpartum as well. Anxiety, totally normal to experience that. If you have anxiety though that is affecting your ability to live your life, that is different. That would be one of those red flag situations. Here we're talking about anxiety that you are recognizing like, oh, I'm feeling really anxious in this moment, and you're able to address why that's occurring, maybe able to take a few deep breaths and get yourself back on track. Ambivalence over the end of pregnancy. This is normal. Sometimes people are like, are you so excited to meet the baby? And sometimes we're like, I'm kind of just happy where I am right now. And that's normal to feel that way. The idea of labor and birth is very daunting. The idea of a cesarean birth, if that's the way that somebody's planning to birth, that can be very daunting. All that comes after the birth can feel really daunting. It's somewhat easy in pregnancy to just take your baby everywhere you go, right? But afterwards, you have to start thinking about all the things that you need to do and how you're going to manage having your baby out in the world. And sometimes it makes us feel like, well, we just kind of would be comfortable staying pregnant forever. And other people are very much the opposite. They cannot wait to be done being pregnant. But it is totally a normal thing to be like, oh, well, I'm kind of just fine with how I am right now. That's totally okay. Feeling really sensitive or really irritable, this is normal. Sometimes people take these feelings out on their closest support people, like maybe partners, but this is a really normal thing to experience at the end of pregnancy. And it's an interesting way to think of it as being protective of your peace. Like when you are very sensitive to things, maybe people's stories that they share or things that you heard or maybe something you saw in the media, and now all of a sudden you feel really offended or you feel really upset about it. That sensitivity or irritability that's created by what you've seen is almost your body's defense mechanism. Like, I'm trying to protect this space that I've created, this positive, empowering pregnancy and birth space. And now I have something coming at me that threatens to disrupt that. And that brings up this sense of anger or irritability or upset at that experience or what you've heard. And that's normal. So the idea is, let's recognize it. Let's recognize the feeling that we're having. Let's say, okay, this is normal and it's good that I'm recognizing this. And then let's try to let it go. Maybe with some mindfulness exercises, one of which we'll do in a minute. And then fear. It's totally normal to feel fear. Sometimes fear and anxiety go hand in hand. I often tell people that it's almost I don't want to say abnormal, but it's if you didn't have any fear or anxiety, sometimes that's like, oh, okay, like that's wonderful. But at the same time, maybe we don't recognize how identity shifting the whole birth and postpartum journey is. It's normal to have fear about that. It's normal to have concern over how you are going to change, both as a person, as a parent, as you shift through birth and into the postpartum. Please recognize that it is normal to feel that way, to feel a little fearful of that change that's to occur. It's almost like I kind of look at it as almost coming out of this like deep respect for the transformation that occurs with birth and postpartum. Now let's talk about some of the things that could be normal, but could also possibly fall into the red flag area. Nervousness about birth and parenting, absolutely normal. But if your nervousness is taking over your life, that would be more of a time that we want to check in with a healthcare provider. Emotional ups and downs, normal. But if the emotional swings are so dramatic in your mood that they're affecting your daily life, red flag. Concern about the baby's well-being, of course, that's totally normal. But if it's an obsessive concern about the baby's well-being, something that is, again, preventing you from being able to live your life, that's a red flag. So those are things that could be normal, but in extreme circumstances are definitely times to reach out to your provider. So here are things that are always red flags. Feelings of isolation. This is definitely a time that requires you to talk with someone, whether that is a therapist, whether that is a midwife or an OB, whether it is a doula, whether it is a pregnancy support group. There are lots of great online pregnancy support groups, which is awesome because it makes your geography not matter at all. So looking for some pregnancy support groups is really, really helpful. If you are experiencing feelings of dread or listlessness, so feelings like just feeling so overwhelmed that as you're moving into this postpartum, feeling like there's just no way this could possibly be a positive experience. Again, definitely time to reach out to someone. If you're experiencing insomnia due to fear, if you have thoughts that are keeping you up at night that are making you feel fearful, that is a red flag. Insomnia because you're getting up to pee 4 times a night and then having trouble getting comfortable falling back to sleep, that's different. Here we're talking about racing thoughts that are contributing to a sense of fear or anxiety. And then, as we mentioned before, obsessive thoughts related to the baby's well-being, affecting your ability to live your life. These are red flags. This is when you want to request a mental health referral from your OB or your midwife. You can also get referrals from your doula, childbirth educator, chiropractor, or pelvic floor PT. Anyone that is supporting your pregnancy should be able to refer you to mental health professionals in your area that can help you feel more confident and more positive moving through your pregnancy. So, what are some things you can do to help work through common emotions that are normal? We're not talking about the red flag situations. We're talking about normal, common emotional things. If you are leaving your prenatal visits feeling more anxious, nervous, or fearful than when you went in, it's time to find a new provider. As a doula and educator, I can't tell you how many times I hear stories from people that are going into their prenatal visits feeling great and coming out of their prenatal visits feeling terrible. That is not a healthy provider-client relationship. It is time to find a new provider. And if there are limitations to who you can find, whether those are geographical or financial limitations, it is really important that you bolster up your support. So if you don't have the option to find a new provider, make sure you are surrounding yourself with some really, really amazing support in both pregnancy and birth. This could be a really super supportive partner. This could be a kick-ass doula. This could be a childbirth educator. This could be friends or family members that are on the same page with you in terms of what you want for your birth, people that can uphold your ideas about birth, people that can help you feel good and positive, so that when you do have those encounters with a provider that might not be on the same page with you, they are counterbalanced by all that positive support that you have. So if you can't find a new provider, make sure you work on your other areas of support. Spending time in late pregnancy connecting with your doula can offer an opportunity to decompress, alleviate anxiety, and build intimacy with that person for birth. Sometimes it's helpful to talk about pregnancy-related things with somebody who fully understands the pregnancy and birth process. Sometimes when we're sharing our thoughts with partners, although they can lend a very sympathetic ear, it's not always the same thing as talking with somebody who has a lot of professional experience in the birth world. So definitely using your doula as a way to kind of talk through what you're experiencing is really important. And then when it comes to partner support, if this applies to you, keep the lines of communication open with your partner. One of the best ways, and this is more, I'm talking from experience here, one of the best ways to help keep those lines of communication open is to make sure you're asking for help or support when you anticipate needing it before you're feeling like it should have already been offered. That is what harbors resentment, and that's not a great way to head into birth or postpartum. So make sure you are letting your partner know what you need, ideally in advance or as soon as you realize it's a need of yours, and not waiting to see if it happens and then feeling upset that that did not happen the way you expected. So keep those lines of communication open with your partner, and also, any other support people that you have that are intimately providing you with support during pregnancy. So now I want to lead you through just a short, maybe minute or two, kind of mindfulness breath exercise. So if you want to do this with me now, you can, or again, you can save this for later. But what I'd like for you to do is find a surface to sit on. You could sit cross-legged on the floor. You could sit cross-legged on the couch or a chair. I'm sitting on a birth ball, wherever you're comfortable. We're just going to begin breathing. So I'd like you to start breathing in through your nose and out through your mouth. We'll take a few breaths here. Long and slow, in through the nose and out through the mouth. Continue breathing here. Something as simple as sitting with this breath for a few minutes a day is a really great way to connect with your body and connect with your baby. As we inhale, I'd love for you to focus on feeling your lungs expand, feeling them fill with air, thinking about all that great oxygenation that you're providing to your baby. And then as you exhale out through the mouth, think of your lungs as balloons that are deflating, coming back together. Now with your next inhale, think about your lungs inflating, all that good oxygen for your baby. Picture your rib cage expanding to accommodate that extra air in your lungs. And then as you exhale, picture your rib cage coming back together and the lungs deflating, coming back to neutral. With your next inhale, in through your nose, let's just sit there with that rib expansion and lung expansion for a moment, and then exhale and let everything come back to neutral. And we'll do that one more time. Inhale through the nose, lungs expand, rib cage expands. Think about all that good oxygen for your baby. And then as you exhale, letting everything come back together. With your next inhale, in through the nose, try to think of that oxygen flowing all through your body. Think about that air even affecting the lengthening of your pelvic floor muscles. And as you exhale, feel everything come back to neutral. We'll do this again. Inhale through your nose, lungs expand and rib cage expands, and your pelvic floor is even affected by that expansion, and your pelvic floor expands as well. And then as you exhale, everything comes back up and in. And we'll do this one more time. In through the nose, lungs expand, rib cage expands, even the pelvic floor lengthens, all that great oxygen for your baby. And then pelvic floor comes back up and in, rib cage contracts, lungs deflate, and we're back to neutral. Taking a few moments every day to do a breathing exercise like this, in through the nose and out through the mouth, is a really, really nice way to slow the release of adrenaline in your body, to increase a sense of calm, to disengage your thinking brain, and to connect with your body and your baby. So definitely try doing this every day, even just a few breaths, to center yourself and create that connection. So in the last minute that we have here, I just want to share with you my takeaway. So recognizing the wide range of normal and both physical and emotional aspects of late pregnancy can help to ease anxiety and set the foundation for a well-informed and empowered pregnancy. Knowing when to reach out to your provider about possible red flags can ensure your physical and emotional needs are met. Never hesitate to reach out to your provider. And taking a few minutes out of every day to connect physically and emotionally with your body and your baby can bring peace and ease while encouraging bonding and connection. So don't hesitate to carve out those minutes in the day where you are just tapping into what's happening in your body and your baby, in your body and with your baby. So we have a couple questions in the chat here. Let me pull them up. Oh, it was just people saying we have to leave now, but thank you. Awesome. I'm glad and happy that everybody was able to come and gather what they could from today's webinar. So a couple of things I just want to mention. We have some free webinars coming up. The next one will be all about understanding cesarean birth. We also have some low-cost webinars that offer contact hours coming up as well, so you can check them out. I will send out this recording to everyone in the follow-up email. And also for all of you who have taken this webinar, we have a discount code available for our Empowered Pregnancy Support course. So if you're feeling like you need to kind of hone in on the pregnancy support, not birth prep, not a birth class, not childbirth education, but simply support and knowledge and education about what to expect in pregnancy, as well as some, again, mindfulness exercises, movement exercises, questions to think about when you're talking with your providers. We offer all of that in a self-paced online course called Your Empowered Pregnancy. So for anyone that has taken this webinar, we're offering $15 off that Your Empowered Pregnancy course, and you would just use the discount code Healthy Third Trimester. So it's all caps, HEALTHY, the number 3, all caps still, RD trimester, TRIMESTER, Healthy Third Trimester, with third being 3 RD. That's the discount code that you would use if you want to check out our Empowered Pregnancy course. So all you have to do to find that course is go to blossomingBelliesBirth.com, go to For Parents, and you'll see pregnancy support there, and that's where that course is located. So you can use that discount code Healthy Third Trimester to get $15 off that course if you'd like to. And that course offers unlimited forever access. So you don't have it for 60 days, you have it forever, as long as you need it. So thank you so much for joining me. I will send out, for those of you that are attending live, I'll send out the recording. Everyone will have access to this recording. Please share it with friends and family. It's totally fine for you to do that. Hopefully this was really helpful and also empowering for you and in getting to know your body and your baby and what to expect at the end of pregnancy. So thank you so much for joining us. I hope you have a wonderful rest of your day, and keep an eye out for that email with the recording available. Thanks, everyone. Bye.